We understand that people are tired and yearn to get on with their lives. We understand that countries want to get their societies and economies going again. That's what WHO wants to. Stay-at-home orders and other restrictions are something that some countries felt they needed to do to take pressure off their health systems. But they have taken a heavy toll on livelihoods, economies, and mental health. WHO fully supports efforts to reopen economies and societies. We want to see children returning to school and people returning to the workplace. But we want to see it done safely. At the same time, no country can just pretend the pandemic is over. The reality is that this coronavirus spreads easily. It can be fatal to people of all ages, and most people remain susceptible. If countries are serious about opening up, they must be serious about suppressing transmission and saving lives. This may seem like an impossible balance, but it's not. It can be done, and it has been done, but it can only be done if countries are in control of transmission. The more control countries have over the virus, the more they can open up. Opening up without having control is a recipe for disaster. It's not one size fits all. It's not all or nothing.
Given the low number of cases in regional Victoria and the fact that our strategy there has been very successful, with only due to the work that each and every country Victorian is doing, we can today announce that on Sunday we'll speak about two roadmaps towards opening up, one for metropolitan Melbourne and a second roadmap that may have different component parts for regional Victoria. That'll be based on case numbers. It'll be based on the science, the evidence and the best of medical advice. But we believe that given the low case numbers, it will be possible for us to have different settings in regional Victoria compared to, and a different timeline, a different roadmap compared to what will be essential in metropolitan Melbourne, given the very different places in terms of the number of positive cases, the chains of transmission. The challenge is different in metropolitan Melbourne than it is in regional Victoria. We will always strive though to make sure that those rules are as simple and as logical as they can be. That's not easy, but we're confident we can strike that balance.
First, prevent amplifying events. COVID-19 spreads very efficiently among clusters of people. In many countries, we have seen explosive outbreaks linked to gatherings of people at stadiums, nightclubs, places of worship, and in other crowds. Preventing these amplifying events is essential, but there are ways to hold gatherings safely in some places. Decisions about how and when to allow gatherings of people must be taken with a risk-based approach in the local context. Countries or communities experiencing significant community transmission may need to postpone events for a short time to reduce transmission. On the other hand, countries or communities with sporadic cases or small clusters can find creative ways to hold events while minimizing risk. Second, reduce deaths by protecting vulnerable groups, including older people, those with underlying conditions, and essential workers. Countries that do this well may be able to cope with low levels of transmission as they open up. By protecting those who are most at risk, countries can save lives. prevent people becoming severely ill, and take the pressure off their health systems. Third, individuals must play their part by taking the measures we know work to protect themselves and others. Stay at least 1 meter away from others. Clean your hands regularly. Practice respiratory etiquette and wear a mask. Avoid the 3 Cs: closed spaces, crowded places, and close contact settings. And fourth, governments must take tailored actions to find, isolate, test, and care for cases, and trace and quarantine contacts. Widespread stay-at-home orders can be avoided if countries take temporary and geographically targeted interventions.